Good afternoon. I'm Dan Simon, your Director of the Department of Public Health here in San Francisco. Today, as we do each month, we're going to go over the preliminary overdose death numbers for San Francisco. This will be for January, and put a spotlight on some of the things the department is doing. Join me today. With me here today is Amin Leal, who's the Chief Ambulatory Care Officer at DPH, and Dr. Tyler Maines, who leads our clinical work in the San Francisco jails for jail health. So let me start with our overdose numbers for this past month. So that's January of 2026. And I appreciate the Office of the Chief Medical Examiner, as always, for timely doing this analysis and providing this to us. So we had 53 overdose deaths in January of 2026. That is compared to 62 in January of 2025 and 71 in 2024. So we are 15% lower January this year compared to 2025. As I say every single month when I'm up here, every single overdose death is tragic, it's preventable, it's unacceptable. And we here in San Francisco at the Department of Public Health and across city government and this administration are going to continue to be tackling this as the public health epidemic that it is. I have come up here often and talked about some of the things we're doing here in San Francisco, one of which is aggressively making sure that people who are using substances, particularly opioids and fentanyl, have access to medication that is able to help counteract and treat and provide a path forward for those with opioid use disorder, particularly buprenorphine. I've talked about some of the things we're doing in the middle of the night on the street or at all hours, where folks can immediately, through a telehealth consultation with a physician, get a prescription for medication and get access to that almost immediately. I've also talked about a range of things that we have started in the city around getting folks started with long-acting injectable buprenorphine, which is the medication for treating opioid use disorder, one of two primary ones. Those have contributed to a very large increase in the number of folks we are getting engaged into actual clinical treatment and services and medication to support and manage and help reduce not only the risk of overdose death, but also to help people be able to overcome their substance use. Today, I want to have Dr. Tyler Maines come up and talk about what we are doing in jail health. We do not run the jails. The sheriff runs the jail. We do not choose as public health who comes to jail, but our clinical teams, doctors, nurses, other clinicians, pharmacists, and others provide the best possible care to anybody that comes through the doors of the jail in San Francisco. Because a large number of those folks have a substance use disorder, a lot of what our team does in jail health is try to connect people and get people initiated onto treatment. They are an incredibly scrappy, resourceful team, and I think is probably, I am biased, but the best jail health team in the country. And today we will also talk about what that team in jail health is doing to actually start people in jail on medication and long-acting injectable medication for their opioid use disorder. So with that, I'm going to turn it to Dr. Tyler to talk through some of the things that we have that are quite exciting for our clinical care in the jail.
Hi, everyone. Thank you for the opportunity to talk about jail health. So I'm Dr. Tyler Maines, Chief Medical Officer for Jail Health Services. Our mission at Jail Health is to provide comprehensive, compassionate, and respectful health care to people who are incarcerated in the San Francisco jails. And we are a fully integrated and collaborative unit within the San Francisco Department of Public Health. While the jails are not designed to be healthcare facilities, Jail Health Services functions as the safety net for the safety net, providing care to those who've been unable or reluctant to engage in treatment in the community. While we do not choose who comes to jail, we ensure we provide the best possible care while they are incarcerated. As such, jail health plays a critical role in helping people involved in the criminal justice system begin treatment for substance use disorders, including those battling addiction to fentanyl and heroin. About 25% of people booked into the jail have opioid use disorder, or OUD. If they come to us already on a journey to recovery, we make sure they're able to continue whatever medications they're on without disruption. If they come to us intoxicated or experiencing symptoms of withdrawal, we help them get stabilized and started on their preferred method of medication as quickly and safely as possible. We also offer urgent care, comprehensive primary care, including cancer, sexually transmitted infection screenings, and vaccines, in addition to enhanced clinical substance use treatment services. We're very proud of our jail health system here, which is a unique model nationwide, and I'll talk about why. We are a national leader in the treatment of incarcerated people, particularly those with OUD. Fewer than 20% of jails around the country offer any medication for OUD, and far fewer offer all forms. We are one of the few jails who offers all of our patients any type of medication for OUD, including methadone, buprenorphine films, and injectable buprenorphine. We recently launched a promising pilot using a weekly formulation of injectable buprenorphine, and this has been a game changer for us because it allows patients to start medication 8 hours after arrest, and the medication stays in their system for a few days. The challenge with starting buprenorphine with the oral form, the traditional way, is patients have to wait 2 or 3 days while they're suffering severe withdrawal. Over half of patients who are brought into jail with OUD are released within that time. So most of those people didn't have the opportunity to start any treatment and were very uncomfortable while they were in jail. However, this weekly buprenorphine injection allows people to start treatment earlier. It allows them to get better control of their withdrawal symptoms and to get to a more stable dose very quickly. And then if patients have a better experience starting the medication, they're more likely to continue that medication when they get out of jail. And I'll share some data around that. Patients have expressed significant interest in this approach. So just last month in January, we had 115 total unique patients receive an injectable form of buprenorphine in the jails. And over the past 4 weeks alone, we had over 60 patients who wanted this weekly injectable medicine a few hours after they got arrested. In jail health and throughout our system of care, we strive to give people all options and decrease barriers to starting and continuing treatment. So throughout all of 2025 last year, our patients showed strong linkage rates to continue their treatment after they got out of jail. So 71.8% of patients who started methadone in jail went to a methadone clinic to continue treatment when they got out. And 48.2% of people who got an injectable form of buprenorphine also followed up within 30 days. We also give patients a supply of discharge medications in hand at the time of release, so they don't have to worry about going to a pharmacy or getting an appointment or activating their insurance. They can continue their medication right away. And we work in close collaboration with many public health partners in the community and recovery support programs to encourage patients to continue their recovery in the community. Everyone struggling with a substance use disorder faces unique challenges. By providing individualized and patient-centered care, Jail Health aims to support each person on their journey to recovery, from the moment they arrive in jail through their release. Thank you.
Thank you, Tyler. And thank you, Amin. So with that, see if there's any questions folks have.
Yeah, for the transition from jail to the outside world, where exactly are you advising them to go to continue their medication?
I'm going to ask Tyler to answer that.
So it depends on what type of medication they started. So we have a unique partnership with Ward 93 at the General Hospital, where their staff actually come into the jail to meet people and start patients on methadone. And if that happened, the person would follow up at Ward 93. For the injectable or oral forms of buprenorphine, if they're already plugged into care somewhere, we encourage them to go back to their primary care home or wherever they are. Or we partner with the OBIC clinic and beam the telehealth buprenorphine prescriber.
Well, and those latter ones are, we have a hub at 1380 Howard, one of our DPH sites, where we're able to prescribe that, provide the actual dispensing of that medication.
When did this
So we first started offering it in 20. Oh yeah, we first offered it in 2024 with the monthly version. We did one initial pilot in July with the weekly formulation to see if patients preferred it and how they responded, and there were very successful outcomes. So we restarted that in January, offering it to all patients.
January of this year.
Yeah, just last month.
Any other questions? One more and then Charlie.
Doctor, can you just rephrase the last few paragraphs you talked about in terms of numbers of overdoses this year?
Sure, not doctor, just Dan, but yes. Let me start over on that then. Thank you. So in January of this year of 2026, we had 53 overdose deaths in the city and county of San Francisco. That is 15% less than January of last year, where there were 62 overdose deaths, and 71 overdose deaths in January of 2024. So we had 53 this month, and I always say this every time I say any of these numbers. Every one of those deaths is tragic, preventable, unacceptable. And what you've been hearing about here from the team, and each month when we profile some of the things the department is doing, is how we are trying to aggressively tackle this public health epidemic, not only with overdose deaths, but the degree of untreated and undertreated mental health and substance use disorder that really is one of our biggest public health crises here in San Francisco. Thank you.
We have time for one more.
Yeah, can you share a little bit more about how the plans for the Reset Center will offset or reduce some of the burden on the jails for providing this type of medication?
So I'll say one thing. I'm asked Tyler. So I think what I hear as I go around with my team is repeatedly our team provides. We don't choose who comes to the jail as health. They provide amazing care in the jail, and my clinicians say they would much prefer to be able to care for somebody not in a jail setting, which is part of what Reset would allow. So let me ask Tyler to comment on that.
Yeah. So when someone's brought to jail for public intoxication, they're typically only in jail for a few hours. So I just mentioned just starting last month, we're able to start treatment at hour 8 for some people. But most of the time, people are even released when they're sober before then. So the Reset Center is an alternative to a jail cell where people can sit in comfortable chairs, have peer navigators, nurses, case managers talking to them, engaging them, learning who they are as an individual. What are their goals? How did they end up here? What is going on around their lives that has led them to the point they're at today? And try to start to understand their motivations for change. If they're interested in starting treatment or they're interested in getting connected to resources. Right now, the jail staff is not set up to do that for all patients coming in with public intoxication. Our nurses do the best they can, but people are coming in with all types of medical emergencies and medical conditions. So to have a center that's dedicated to this patient population, providing that level of service, is a great alternative to our current state.
Great.
One last one real quick.
We have time for one more.
Sure.
If people see this news report and want to need help, what do you tell?
Sure. So if you're watching this and you have a substance use disorder or a behavioral health or a mental health condition that you need support on, there are many resources and options. And actually, you can actually, we didn't plan this, but you can call our one line 888-246-3333 Monday to Friday between 8 a.m. and 7 p.m. and on the weekends between 9 a.m. and 4 p.m. And you will be able to talk to someone that will get you plugged in to some sort of resource depending on what your needs are. There are many, many options in the city for someone that is ready for support and treatment to quickly get access not only to medication, but to healthcare services for their opioid use and other behavioral health conditions. Thanks for that question.